some of the PRRT work because I think it helps to prepare for more specific work of the ribs. So I will show you two techniques, and they are pretty nice in helping mobilize the ribs initially. So, who worked with him? Did you?
I did.
You did?
Yeah.
Okay. So what were your findings, or should I go over it?
You can go over it, but I mean, I was getting a lot of restriction through that right side.
Okay. So restriction through the right side. Okay. 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 Sit for me. Let me just gather some. Actually, you can face that. So we can start breathing. So I will just show you how. Okay. Shrug your shoulders. Relax. Okay. Breathe in. And breathe out. Breathe in. Whoa. Take a deeper breath. Breathe into your chest and to feel. Yes. So many people, relax. Many people will, if they've taken DNS, they start to belly breathe and they stop chest breathing altogether. This is not a good strategy. Not at all. You must have full costal respiratory strategy. The breath must start low, run into the thorax and upper chest, continue to expand everything, and then it collapses like a wave that crashes on the beach. You cannot fill the lower abdominal wall first and then fill the chest. It will never work. And you cannot just do the abdominal breathing. But it must start circumferentially here, and then it all rushes out. So many times you will see this phenomena where, relax, I actually have to instruct him to breathe into his chest because he stopped. Thank you.
He's a little scared.
If you are not, I'm not even going to answer you. If you are not breathing into your chest, these ribs will come down because they don't have to move at all, and you will have shoulder problems. So it's important. So you breathe in. So I see excursion, but no separation. And you're right, on the right side, it is worse. Okay, and here.
How long he will live?
Not much longer. Huh. Okay, breathe in. I get separation. I feel more restriction on this side. Yes, yes, on the left. But let us see, lie on your side, and I will check it. Breathe in. Okay, not so much. Turn to the other side. Breathe in. Yes, so the right side is better. That's my finding. But we can discuss it. Sorry. Lay face down. Okay. So, okay. Okay, so sorry, no, lay face up. Let me show you this. So, with there are PRRT moves are as follows. I can I don't want you to choke, so you have to spit that out. I know, I get it.
No garbage can.
Where's no garbage can?
You gotta swallow.
All the way to the bathroom.
So, we can start off by having him raise his hands, spread his fingers. And if I am looking, which side did I say was more restricted? Right. So, I can start off, I just need that chair. So, I can start off with the angle, well, let me just start here, let's say. If I want to affect more the lower part of the thorax, I will start to the higher angle. If I want to affect more the mid and the upper part of the thorax, I would start this way. Anyway, the arms are extended. I ask him to close his eyes. I'm going to bring him here. I'm just trying to feel the trajectory of serratus, where it would attach to the fibers here, the fibers of the pec, affecting these ribs that go down here. And in this position, I will tell him when I push down, you must reach to the ceiling in this direction as quickly as you can. Are you ready? I mean, as quick as you can. You ready? Yes. Relax. Good. Oh, quicker than that. I'm winning. Ooh. You ready? Thank you. Quicker. Okay, relax. So, that's one technique. Let us see if you lie on your, which side did I say this side?
Right side.
Yes, the right side.
So right upper,
Yes.
right upper, and then left lower.
Left lower, that's right. So, let us see. Sit again for me. So first of all, breathe in. That's better. Okay, shrug your shoulders. Drop. Is that tender? No. Breathe in. Yes, better. Breathe out. Breathe in. Yes. So, let me check, lying down on your right side, I should see, breathe in, yes, now you see my thumbs move. Does this mean a permanent fix? No, it is telling me that in order to restore this, I must release this, and now he must get a feel for breathing into his left side. I must encourage it through exercise, through more fascial work, and he must himself self-mobilize through respiratory focus. So maybe I'll tell him that every hour he can have a breathing, there are breathing apps, and every hour or 2 hours, that app will come on his phone, and he's to use that cue to breathe into those areas that he doesn't feel, so that he can start to automatically use this area and incorporate it into respiration again. That would be a better way than my saying, well, next time you come, we're going to do more breathing exercises. That's not enough. It's like smoking. He must start to smoke 20 cigarettes a day if he really wants to get good at being a chain smoker. You can't do it once a week and hope to work up to it. So you really have to give him every day the instrument of encouraging him to use what you have loosened in the clinic, so it doesn't become stagnant again.
Do you have the name of a particular app, or?
Yeah, let me see. On my phone I have one. Let me get it for you. But there are many out there which you can use, and this helps the patient to do regular breathing exercises by cueing them on their phone. So that way you take the stress off. Oh, I forgot to do it, or nah, I didn't remember that you told me to do the breathing exercise. So that's one way of lie back on your back. One way of treating, this is PRRT. The other way is a little slower. You can block one side by pressing down on the table. So that locks down one half of the rib cage a little bit. And then on the other side, I place his arm on my shoulder. I embrace his shoulder, his shoulder, around the deltoid and armpit. And now I ask him to spread his fingers, press down on my shoulder, and reach towards the corner of the room. Go, 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 go. Go, 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 go. Yes. And press down on the other side with your left arm. So you're pressing down with that arm. Good. And breathe. And then slowly you let your arm come back down to the table. And again, press down. So what do? I take pec out of it, reach, and he must use serratus. Good, hold, 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 hold. And relax. Sometimes I will do it in this relaxed position, sometimes I will do it in 3-month position, so I use the canister to help stabilize whilst he mobilizes the rib cage. So he can be in this position, good. If this is working well, good. Don't push too much, good. Press down, and reach, 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 reach. Press down the other arm, good. And slowly. And I only do like 2 or 3, good. And relax. And then I can always come in and check the mobility trigger points. How soft the rib cage has become. That you can see. Look at the difference if I press on this side and I press on this side. Yes. So I will do this side and we'll see. Okay. So press down a little bit.